There we go. All right. Good morning / afternoon / very early morning to all of you. Maybe even evening. I don't know. I'm Denise Hyde again, community builder with the Eden Alternative. I love all these faces. Thank you guys for being on the call. Oh my gosh, Ruth says they have 9 in the room at Denali Center, all appropriately physically distanced. We really appreciate you guys doing that. It's awesome. So terrific. Again, find your chat box. So find a little button that says chat and open that up and be chatting away because we definitely want to hear from everybody while you're on the call, your ideas and stuff. And I will keep an eye on it. And I know my teammates will help me as well, just to make sure I don't miss anything exciting. And we had 2 questions that were posed today. One, Dr. Thomas posed, which has just been like in my mind all week. So I have my list of things that I would say to that question. But we really want to hear from you. And that is, how are you challenging the status quo right now? And what will be different when this is all over? And so we kind of want to hear from you on that one. And then I had another one sent in to me by Erin and the team at Eden Gardens up in Canada. And they said, you know, we're really trying to figure out how best to help people deal with the stress and the loss and the grief and the guilt that's going on right now, and just really some ideas of what people are doing around that. So we can go either one of those directions or chat in the chat box if you've got another issue that you would like us to take on, because that's what we're here for. You are the experts. This is all about all of you and helping us all get through this together. We just really want to honor everybody in this room today. So thank you for carving out time to be with us. Again, if you can, go down to the mute button and make sure that you mute yourself so that we get a clean recording and all that kind of stuff and don't talk on each other. But I'm gonna start with the first question because I don't see anything else in the chat box just yet, but I think this will be really fun to talk about. Oh, good. David and hi, Hope and Imelda, we're very glad you're here. Yay, Wendy joined us. All right. Mary Anita, Stephanie, oh, Tina's back, yay. Okay, awesome guys. So the question was, how are you challenging the status quo and what will be different when this is all over? So I don't know if anybody had any thoughts to kind of open the conversation. You can unmute and share, or you can chat in the chat box.
Denise, I think Imelda was wanting to say something. I saw her raising her hand.
Go for it.
Did you all see Rachel Maddow last night? I just thought she hit it right on the head with the deaths that are occurring in nursing homes, which I understand are over 5,000 now. And she just talks about the problem being how we view old age in our society as is reflected by the budget. Oh, wait, I'm sorry.
You're good, Imelda.
Is that better?
Yep.
Okay. She spent the first 23 minutes of her program on the deaths in nursing homes and the causes for it, and the disregard as reflected in the budgets. So I would encourage, I'm going to transcribe those 23 minutes. They're just amazing.
Wow.
So changing the status quo, I think Rachel Maddow in her segment talked about the need for changing the status quo and how we view our frail elders who are in a retirement setting.
Wow.
Was there only one other person who saw it? Did I say Evie saw it? Yes. Anybody else?
No.
But just to let you all know,
look for it though. Yeah.
I saw it this morning and I saw it on YouTube, so you can all go to YouTube.
Oh, good, good.
Okay.
I saw it last night, Imelda, and I was very impressed by it because Rachel in previous shows had been kind of following that path of you should get your elders, your family members out of the nursing homes as quickly as possible. And she was going down that negative path, and I know that I actually tweeted, I never tweet. I tweeted Jill's article. Jill wrote a blog And I tweeted that right to Rachel directly because I was mad at Rachel. And I let Jill know that I did that. And she said that a few other people had sent her article and had had conversations about that we need to tell Rachel. And then last night, I think she read at least one of the tweets or emails or messages, because last night her tone was different and
Yes.
it was amazing. It was
Yes.
wonderful. You know,
Yes.
I like to think that we had something to do with her changing her tone. But she finally said that nursing home workers are heroes and that they need our support, and we need to stop blaming them and start helping them. So yes, it was really good.
So to answer your question about changing the status quo, maybe this will put a new light on the needs of providers in running a good nursing home, just budget-wise.
Yeah, we should all share it on social media if we are so inclined, so that it gets around her video clip.
Yeah, and I see Terry put in the video clip for all of us, so thank you. You can go right into the chat box and click on that, or well, don't click on it right now. Copy and paste it. Stay with us right now. Yeah. That would be awesome. Yeah, Jill's saying, yeah, we all need to speak up in support of nursing homes and care communities. Absolutely, absolutely. They are doing extraordinary stuff, and it is very sad. Imelda, I'm with you. It's very sad to hear the numbers starting to show up, and it's like, oh my gosh, so much wisdom.
Denise, can I make a comment that is based on that? One of the, and I haven't done a study on this or anything, but one of the things I'm sort of seeing, and I had also shared, there was a great story about the Signature home in Morgantown and how the community rallied around that nursing home, and Ryan's here, so he may be able to speak to that, rather than blame, right? And I'm wondering, and I saw something similar with a community in Steamboat Springs, Colorado, and one of the things that made me start thinking about is in a place, in a small town where there are connections, where the people in that town or city or whatever feel like that nursing home is part of their community, when there are all these connections, that's where you see the support versus the kind of homes in maybe larger areas where community isn't such a part of the realm of, you know, that society, or where the nursing home isn't deeply connected with the outside community. That's my take on it, is where they're getting the blame because they're not known. And I don't know if anybody, you know, from Signature, you know, would speak to that, because you have so many homes that are in rural areas. Are you seeing, and maybe that's something we think about for the future, is how do we have these communities, and we've been talking about this for years, be a part of the larger community? Just a thought.
Yeah, I mean, I see that Angie is on, and she could share more in depth because she is closer to some of the homes than I am geographically, and she knows those towns. But with Morgantown, it's just they have such investment into the community before all of this happened. Same way with the Putnam County home, and it just really makes a difference when there's those relationships there versus, I think, like you said, the larger homes maybe in a larger area. But I do think Angie could speak more on this.
I think Ryan was doing a good job. Can you hear me? Okay, I didn't know. I'm having trouble with this headset. Sorry, friends. So, you know, we did a lot of that community building with Wendy's Neverland in Morgantown. They were our first site to do that performance and that community launch. And so the community just has been heartbroken there that they've had so many cases. And I mean, it has really been, they've really been engaged on all levels. Yesterday, one of the local churches dropped off, I don't want to say a little bit of food, I mean baskets, grocery baskets full of food for our employees there, for our stakeholders, and they're leaving with, so that they don't have to go to the grocery store, because you know, there's just, we're trying to keep people safe, right? We need to keep our elders safe. We need to keep our stakeholders safe. And the less limitation that they have with other people. And that's been things here in the town where I live. We lost my good friend who was a CNA at one of our communities this past week, and I'll try not to tear up, but the community here has just really been outstanding, and even so symbolic to have went in overnight and built a cross in front of our nursing home. It was just so symbolic that the community loves you and we're here for you. And we're seeing those types of beautiful things everywhere. And back to what Imelda was saying at the beginning about the funding streams to nursing homes. I don't know how aware people are, but I will say this, that the federal government allotted funding. It's called FMAP funding to healthcare and other for COVID-19 responses in each state. The governor of every state dictates how that funding is used. There are several states that are allotting funding to go towards extra pay increases for people working in these environments, extra money for other things, for nursing homes specifically. It's called FMAP, F-M-A-P, and you can Google it, and I can send you some information on it. But we're actually starting today, we're launching a letter writing campaign within our communities because we have we have such a proactive governor, but he denied that funding in Kentucky. And so we're actually going to start a letter writing campaign where you can email the governors and request that some of that funding goes. So, if people are looking for a cause to pick up, Imelda, you certainly are correct that we need to try to figure out how to get that funding, some of that squared away to where it needs to go.
Very nice, thank you. And Angie, I think I saw that Signature is also doing its own fundraising to make sure there's plenty of food at the homes for the employees to use and such. And I didn't know if you wanted to maybe in the chat box put something about, if somebody wants to be involved with that, how they might get involved. And I'm sure you all have different ways that you're doing that kind of stuff. And I would encourage you to share. People are looking for ways to be involved and be engaged. And if you want to put that out there, I think that'd be okay. Oh my gosh, that was wonderful conversation. Wow. Wow. Angie, you're getting lots of thumbs up for staying connected and letting people know what's going on. And we are very sad for your friend that you lost. I'm so sorry. Anybody else, anything that you thought about in terms of how you are challenging the status quo right now and what actually will be different when this is all over?
Yeah, I can go. One thing I've noticed, and it's more on a thought theoretical thing though too, is I think when this is all over, something that will be different is in talking about the 3 plagues, that every single person on the planet is going to have a lived experience for an empathetic response to what it really means to be isolated, to be bored, to be helpless. And I've already been seeing that a lot, just even in my conversations with, folks who, aren't never really cared about the work that I did. And all of a sudden they're like, oh my gosh, I get it. How can this be the state of being? And so I'm hopeful for the expansion of empathy and compassion that's going to be possible after this, when we go out and talk about why isolation is so damaging and why we need to work to change it.
Kyrie, on that same note, I had the opportunity to be on a call yesterday with the team from the Sarah community, who is, I think, still the most recent registry member, because things kind of slowed down right after they joined. But it was a very interesting call, hearing how they're doing, and they have one case in their community. But Sister Betty, who is has been real active on the steering team, she expressed her sadness and her concern that even though they they are, like so many others, working so hard to find ways to keep residents engaged, to make sure that they're interacting, that they're keeping, you know, whatever communication they can with families. So I truly think they're doing a wonderful job with that. But, and I think she does too, but even in that, she said, we're going to have people die of loneliness. And somehow saying it like that in the context of that just put a reality to it that I think we've all known in our hearts and we've all believed. But I think seeing it in this way is just, it's just profound. And I hope it wakens more people to understanding just how profound and real it is.
Wow. And Joan, I had mentioned that I was going to point out the, because Pioneer Network put out a really great email on Wednesday asking the question, is person-centered care forsaken in the midst of COVID? And I don't know if you want to say anything about that email.
Yeah, it was it actually was sparked by a text message that I got from one of the board members from MC5, one of the prior board members, who actually works for an organization that is very person-centered in their practices. And she just, she hadn't been off duty for a month, and she's tired and frustrated, and the question kind of came up, and so it really got me thinking about it. And you know, one of the things that we said early on at Pioneer Network is, you know, when people say, well, how do you respond to this? The response wasn't to go out and do a bunch of education about person-centered care, because quite frankly, if you didn't get it, this isn't the time you're going to get it, because you're not listening. But I think what we're seeing in the stories we hear, that I've heard in this forum, that I've heard in so many forums, is that there are incredible things happening when organizations have had that foundation of relationship and person-centered care. They've been able to build on that, and it's Jackie, I see you're on the line, and you will see Monday there's going to be a wonderful example that Tim Knight sent to me of what's happening at your communities. And I think that's what's happening here, is we're seeing the people that truly understood and live that culture that we have been talking about. It's helping them even in these most challenging times. And I fear that for those who aren't, they're struggling in ways that certainly none of us would want to see anybody struggle, but I think it's happening. And I think the challenge in that is what we've talked about on this forum as well. Those are the lessons we have to learn. And this may be our opportunity. Out of this sadness may come an opportunity to share and show the world that it does make a difference when elders are in a world where they are respected and honored, and where the culture supports them and not an institution or a hierarchy. So that's kind of where that came from.
Very nice. Thank you. Thank you. It's awesome. So you guys check if you're not getting Pioneer Network emails, you need to be getting them. And Jackie, I don't know if there's anything you want to add.
And it's on Facebook too, Denise.
Okay, good.
So I can add that we are exceptionally proud that our efforts and everything that we've put in place have left us with no member cases of the virus, and we are now making plans to do a switch out of staff on May 1st for the ones who've been on lockdown since April 1st. And so we're building those teams right now. And we've already been disinfected by the National Guard once here in the state of Georgia. And we're looking forward to when we don't need those services anymore. But the fact that our staff has hunkered down, we have 60 staff that are living in-house and have been for the last 3 weeks. Building relationships, being with the members, facilitating communication with their families, and making sure that the days are still full and that the members are safe and everybody's healthy. That's what it's been all about. Wow. And so you know, we're just making plans for what we're going to do next to keep everybody safe and healthy. And May 1st, I'll be on lockdown, and somebody else will be taking my place doing the supply runs for everybody in-house. So I'm looking forward to that, not having to go to the stores. But it really is about putting people first and putting all the processes second.
Yeah.
That's really what it's about, and making sure that, you know, at the end of the day, we have done the best by everybody that we've been put in charge of caring for. So,
Thank you.
you know, and it makes a difference that, you know, like I said, we had the foundation. We're not learning this now. We're good at it. We're, you know, here at Park Springs, we're good at it. So I'm proud to say that I'm proud of the whole team there. And Joan, thank you for taking that article from Tim. It's a pretty amazing article.
Very good. Thank you, Jackie. Thank you. And Hope, you had a comment. I don't know if you want to say anything about that.
Oh, I was just going to wrap back around with Angie and you know, sit in a moment of silence for her loss and just kind of put it out there that it's okay to not be okay during these times. I mean, that so many people are struggling, even the homes that are, you know, really have built those relationships. I think, you know, when they have loss, it hits home even more because they're so close and it's family. So I'm really thinking about you, Angie, at this time. And, you know, just looking at day to day, I know I've been home a lot and then I go into the hospital once a week. And so I'm not what's considered the front lines. And I think there's a lot of triage going on right now. And people in the homes haven't been able to slow down while the world outside has been, right? So we're all stuck in our homes and we're taking moments and we're able to reflect. And, you know, I've given my neighbors more meals in these last couple of weeks than I have the 5 years that I've been here. And I'm surrounded by seniors in my community and I work in this movement with you. And I'm just recognizing, wow, why is it taking this for me to share my meals with my neighbor? And so I think there's a lot of learning happening right now. And I'm hoping that once we're over this, that the individuals that are serving and supporting and are working endlessly have some form of sabbatical in time. Like I hope we can weave that in for them so that they have time to reflect the way that we've had that time.
And Hope, I know you're doing a lot to help your communities really like help people de-stress and kind of deal with all the emotional content that comes with their days. And I didn't know if you had any ideas. That was a part of what we might want to talk about today. Do you have any ideas you might pass along that we could take to our communities and help them?
Lots of breath work.
Okay.
I mean, that's where it starts, is just finding your breath in the madness, you know, and just giving pause. I think that's been the biggest thing, and being okay with it not being okay. I think we're mostly focusing on just making sure those basic needs are met, that people have individuals to watch their kiddos, that they have food source, that they're heard, that if they need to take a break, that break is given. There's been a lot of what's the word I'm looking for, quiet rooms that have been created through this process so that people can go and sit in a space with aromatherapy and maybe some calm music and kind of reset. Yeah, and just I think that active listening.
Okay, thank you. Thank you.
Thanks for asking.
Yeah, hi.
I'll jump in. First off, I just want to say, wow, I get to hang around with some really cool people. And the second thing I want to say is, over the years, I've seen people in our field cope with other kinds of disasters, you know, hurricanes, floods, so on. And over the years, I've heard extraordinary stories about how the team came together and how everybody did what needed to be done. And then there was always a second chapter that nobody talked about that much, which was after the disaster, all this collegiality and teamwork and dissolution of steep hierarchy and all that disappeared. And the organization snapped back to exactly the way it was before. And I'll give you a classic example. This will just take one quick sec, but after Katrina, there were people I knew at a nursing home down there who evacuated the city. And where they evacuated to, there was no power. And so the person who had been in charge of maintenance somehow got power on. And I remember being told by the person who was telling me the story that this man was extraordinarily resourceful and talented and capable. And yet, when they went back after the flood, he went back to being the maintenance man. In other words, we could see that this was a person who could solve really complex, difficult problems in a very challenging environment, just about everything you'd want in a leader, right? But he never had an opportunity to become a leader in the organization. So what I wanted to say here is these stories I'm hearing, why would we go back to just doing it the way we used to afterward? I don't know. Why wouldn't we use this as an opportunity to set in motion a new way of being and organizing ourselves? And I'm throwing that out to the group because there's basically no place on the internet you can go and be more impressed and in awe of than I am with you. But what comes of this? What comes of this great crisis? That's my question. And I'm throwing it out to everybody.
I think we need a storyteller. Bill, you're a tremendous storyteller. So we need to get those stories out there. And I'm thinking of somebody like Steve Hartman, who's and everybody who's ever dealt with anybody who's lived a life to be affected by this industry knows that those who are served all have stories. Why does it go back to the way it is? Because there are many who benefit from convention. And at the risk of being controversial, I'll say that I don't think that the trade associations have covered themselves with glory.
Very interesting. Jill, you go ahead, Evie.
I just want to say something in response to Bill. And I think I've said this before. I think we're in a time of a global spiritual awakening. And this is our opportunity at every level to save the planet from body, mind, emotion, spirit. Every aspect of our life is out of control and harmful. And so people have to really reflect, and people have to be really thinking about what is possible. We have to change everything about our planet, which reflects, of course, on our nursing home world. So yeah, this is our time, guys.
And Jill, you had posted something about hearing from communities that are talking with the elders. I don't know if you want to say anything about that.
Yeah, we heard this from one organization in particular. I'll let them speak up if they're on the call, but it's a community where they're an organization where they're hearing from the elders that life feels more peaceful right now. It feels more like home right now because there aren't all these people in and out of my home, and it's not, just busy all the time. And what this person said is, we're talking with the elders about what do they want life to look like after this? Do we want to go back to the way it was? And how can we retain some? And again, it's not pleasant not being able to have family come in and things like that. But what can be taken away? What's the lesson there? How can they maybe not go back to the way it was? And they're actually talking about that already. How do we have this be what the elders want it to be now that they've experienced a different reality? So that was really interesting.
It is. And I was listening, Eric from Sherbrooke had sent out some video links. And so I was listening to one of his video links yesterday, and it was really interesting. He was interviewing people about how their jobs have changed. Because like we were just at Sherbrooke last June, and it's just this hub of excitement and energy and people and all these gatherings and spontaneity, and it's just wonderful. And they've literally got to stay in their neighborhoods and really slow it down. And so what was really cool was interviewing people about how their jobs have changed. And so he was like interviewing this OT person who normally would be in the wellness gym, and everyone would go to her to get the services that they need. But now she needs to be in the neighborhoods doing the services. And so she was talking about, oh my gosh, I thought I had really close relationships and we had all these connections, but now I'm in where they live. And she's like, I'm sitting there fixing something, because she does all the equipment maintenance kind of stuff with the adaptive equipment. And she's like, people are coming up and they're helping me kind of figure out how to do it and giving me advice. And they're, oh, you know, I had this really loose screw and this wasn't working quite right. Things that would never have come up otherwise. And so there were several people, the artist in residence was talking about that. It's like, yeah, why doesn't that continue when this is over? Why would we go back to everybody's in their own little pocket of the world? Yeah.
Denise, I think I posted it. Was it the podcast? I think I just posted the link to it if anybody wants to listen to it.
Yeah, it's kind of long.
So,
Bill asked Bill asked a question, and then Jack commented that what we need is a great storyteller. And of course, no one does do a better job than you do, Bill. But here are all the stories of how life can be different for the people who are older and living with different abilities, no matter where they live, whether they're in nursing homes or their own homes or assisted memory care, etc. Why can't we pull all this together into something that, if Rachel Maddow can do a show that we're all talking about, why can't we get somebody to do this with you, Bill, in maybe a documentary or something? What good can come out of COVID-19? And we have all the stories right here.
I think we can do it ourselves. We don't need somebody to do it. And I'm thinking, we had a marketing director here years ago who did a wonderful thing. She would interview residents and give those stories to the local press, you know, the throwaway newspapers and just the local little newspapers. And earlier somebody was talking about, I believe it was Morgantown, about how they had community support because they built that community support. We all can get these stories. Well, those residents who can tell their own story, you can encourage them to tell it. I'll tell you right now that it would be very hard to draw my story out of me, but anyway, but you can, if you can get the resident's story and present them locally, and then that material, if you think in terms of the old-fashioned press, and then use it for your social media platform. That material that you disperse to the hometown news works very well on social media, particularly if you can bring some illustration along with it, something that really humanizes it. And I think the Steve Hartman insight that everybody has a story is so compelling. So I would say, rather than having somebody, you know, like somebody in Hollywood tell our story, if we all tell our stories in our local circles, that gets the story out there. The difficulty is, and we've seen this with the situation there in Andover, New Jersey, there are bad actors, and that's the issue that is so difficult to deal with. But I think for all of you who are doing the right thing, getting the story out there, just telling the individual stories of the people you serve and love can be uplifting and meaningful for you.
Sister Imelda, I can see you talking. Go ahead and unmute. We want to hear from you. You're not unmuted, Sister Imelda. We can't hear you yet.
How's that?
There you go.
Okay. I just, to build on what has been said, there's nothing stronger than a story well told. Can we move, I'm thinking of the Institute of Medicine study that brought us OBRA. We have enough stories, research data in qualitative research that would form the basis for making policy changes in nursing homes. If there would be a clearinghouse and an organization that are individual within an organization who could meld all of this into a comprehensive, a qualitative research project to effect policy. So we can do all of the social media at the same time. But it does go to public policy. And I totally agree with Jack Cummings about the bad actors, and we can never protect them. We want to get them out of our profession, in fact. But if we have policies that would provide a living wage for our care providers, think what home could look like for people in nursing homes. That's my thought.
That would require that the trade associations become proactive rather than reactive. Right now, most of the trade associations in the industry, whether they're nonprofit or for-profit, spend most of their energy protecting the industry from government intrusion. And if there were a proactive program of what constitutes the vision of the industry, and if the trade associations could be encouraged to take the lead in that exercise of empowerment, and I'm talking about Leading Age, Argentum, the American Senior Housing Association, all of these trade associations, then the dream that you have could be realized. But as long as it's just reactive, it's just an expensive exercise in containment and protection of the status quo.
Wow, that's a paradigm shift in my head. Thank you. Wow. Wow. Oh my gosh. Okay, so I'm looking and seeing Ruth, you guys up in Denali Center, we want to honor them from Fairbanks, Alaska. See if you have anything you guys want to add to the conversation.
Yeah, well, last week we joined, Tina, our director of nursing, really thought it was important. And so we had 3 people join the meeting last week. And Dr. Thomas's call to action about, challenging the status quo really kind of struck us. And so it's really a challenge because change takes time, right? And this thing has happened so fast, and we want to make those changes immediately, but you can't just make change happen that fast. So we started the conversations, and we've been trying to pull together our Eden associates and kind of do like just the start of the restructuring of our Eden Council. But we were able to get, so today we have 16 people in our activity room all spread out, watching this right now and listening and getting re-inspired and bringing those thoughts in. So we really appreciate all the feedback and things that are going on with you guys and listening to what everybody has to say. For us, we've had 2 people that were COVID positive and they've survived, and so they're doing really well. But unfortunately, what we've seen, and with loneliness, helplessness, and boredom, we've had 3 people with pretty much end-stage dementia pass away. And that really has hit hard. And this 4 weeks into it now is really a challenge that we're all feeling right now. And that sadness and grief that everybody's coping with is real. And so how do we support each other? And how do we challenge that and meet that? So that's kind of where we're at right now, going day by day and trying to find those fixes. Because we do have a lot of support. There are a lot of good things going on. We've got great community support, people reaching out to us, but it's still, it's that beginning of burnout, that beginning of the trouble that we want to make sure that we don't go back to. So, yeah.
I'd love to make a comment here, because first off, And I see the good people behind you. And I want to say to each and every one of you watching, thank you for the work you do. Thank you for the people who raised you, because they did a good job, okay? And you are living in history. And that's a very difficult place to live. So here's what I want to say about burnout. Most, not all, but a big part of burnout comes with the tension between how you're living and how you think you ought to be living. So people who get burned out feel a gap, a terrible tension between how they actually are living and how they think they should be living. And one of the ways to respond to this is actually to say, we are living this together inside a global catastrophe unlike anything experienced by humans ever before. So every day is new and every day is different. And here's my point. We have lost the refuge of the humdrum everyday life. And that is a powerful refuge, and we all need it, but it's not there now. So if we are able to acknowledge that we're living in history and that every day will challenge us, and that is to be expected at this time, it will take a little bit of the edge off from the burnout. Will not fix it, will not eliminate it. But if you can help each other by reminding each other that this is an extraordinary time that your grandchildren will talk about, and you are living in it. If you can do that, it can give you some of the strength you need to get through the hardest parts of this, okay? So I say to my friends, we will endure and we will come out better and stronger than we ever were before. And I believe in you.
I just have to support that, and I want to speak from the position of what you guys call an elder. My earliest memories were of World War II, and World War II was comparable to what we have now. The cause was so great. Everybody wanted to be perfect, because if they slowed at all, it might cost the life of their buddy or whatever. And so there was this same kind of tension. And as we came together as a nation and began to support what we were doing and realize the importance of what we were doing, those feelings went away, and we were able to feel good that we were engaged in a noble cause. You all are engaged now in a noble cause. We're faced with a threat perhaps comparable to that of 1918. I don't think it's comparable to the threat of 1378, when the bubonic plague took away a third to a half of the population, but it's a major threat on the order of magnitude of what we in America experienced in World War II. I know that it's nothing like what people in Europe experienced, but it was still a challenging time. You're rising to the challenge. We as a nation are rising to the challenge. We may not have the same kind of inspiring leadership that we had in World War II with the fireside chats, but we do have Dr. Fauci. Thank God for Dr. Fauci.
Very cool. Thank you. Oh my gosh, I'm so inspired. Team Denali, how you doing? Okay.
We're doing okay. No, we're doing okay.
Okay, good.
We're doing good. Thank you.
Good. So Sally, I want to just divert a little bit. You got up at 2:20 in the morning to join us. So she is up in the middle of the night, you guys. And I just want to give you
Morning.
some time in the morning. Yes. Well, yeah. Okay. And just give you some time because you had some questions and things you wanted to kind of bring up to the group.
It's been really interesting listening to everybody, and Bill, your comments about burnout are really timely, and I think that's something that people need to understand, is that, you know, the way we lived our lives or did our jobs, that doesn't exist anymore, and it's everything has been blasted off the canvas, and it's a new opportunity to write the canvas. So and we're discussing this very early on. One of the observations that I'm seeing here, so I'm in Australia for the rest of you who are not quite sure where I am, is we're in lockdown at the moment. Community as well as residential care and community care, all our community care centres are closed. There's none of that happening, and I'm assuming it's the same in the States. But I think the hard work, if you think now is hard, I think it's actually going to get harder. And how do we build strength with the teams, and also with the elders? And IT has become a major source of connection, whether it's smartphones and tablets and computers and big screens and you name it, it's coming into its own. And I don't know how your homes are going with that possibility of connection. And we see lots of really good stuff around on Facebook of how people are connecting and letter writing. But once that flurry is done, what's going to happen next? And I have some concern that the real rubber hitting the road is about to happen. And I don't know that people are resilient enough right now. I think they're exhausted more than anything. So how do we help to shift that and to build strength more than anything? That's my thought at this point. But we've had some feedback from some of our homes. What they're saying is, with less people in the homes other than, you know, those that need to be there, it's quieter. The residents are getting on with doing whatever they need to do. It's less falls, there's less infections. And it makes you wonder then, how do we, you know, if we're looking about the future, how do we take this home feeling and continue that? Not stopping people coming in the door, but really trying to place ownership in the hands of the elders that live there and the staff that work there.
Nice. Thank you, Sally. Thank you.
Denise, I just have a quick story, if that's okay if I share. Hi everybody. Hello, thinking of you all. I've worked in very large organizations, well, same organization, but I also worked at a very small nursing home. And something that happened to us is there was 10 elders in each house. It was skilled nursing, as opposed to the other place I worked at that had 475 elders in one place, right? So I've seen these kind of differences. In the small homes, we had a perfect survey from state, yay. Well, the feds didn't like that, so they came in and they surveyed us again. Thank you very much. But what we learned from that, having those small connections, and we didn't do tours in this place. We did something once a month that was called Tea Talks. And if anybody wanted to come into our house and learn about what it was like to be there, they'd have to come in, sit with the elders, have tea, have a little pastry, right? There weren't tours, and then the elder might show you their room if they felt like it, right? So we had these feds come in, and they just threw everything into an uproar, right? You know, the staff had to cook, and they started pulling everything out of the refrigerator at like 4 o'clock in the afternoon. It was awful. But one thing I really learned is listening to those voices of the elders. This was truly their home because it was small. They were connected. They knew the people that came in their door, right? And they knew who was supposed to be there, and they knew strangers. And so they had these feds, right, surveying us, walking around the dining room table. Now we had one communal table. All the elders and the staff are sitting at that, having convivium and having lunch. And they're walking around with their clipboards, and the elders look at them, and they're just kind of like, one of them finally said, "Would you please sit down? We're having lunch." You know, and I will never forget that moment. To me, it was like because we wouldn't say anything to them as staff. It wasn't us, it was the people that lived there that said something. So getting back to that smallness, that community, You know, I just think that's where the magic, these cross-blended roles. I think that came up in the chat box. You know, we're seeing, you know, executives get out of their office because we're short-staffed and participated, right? You know, OT people are fixing people's hair, right? This is what, to me, this community is, and where we can come out of this stronger in the end. So I just wanted to share that. That's just kind of been hanging on my head there.
Thank you. Thank you. And Mary, I wanted to give you a chance if you wanted to say anything, because I thought you had a really good post in the chat box.
Is it this Mary?
Yeah.
Okay. Yeah, I mean, in terms of just challenging the status quo and what will be different afterwards, what I'm seeing lots of different things, but what I'm observing that I'm just really paying attention to really intensely is how the executive team is in intense support of the frontline team members. And that happened before in a more distant way, like here's our benefits package and let's make sure people get paid a living wage. But now it's like toe to toe, so-and-so community needs their face masks, and they've got somebody who's been, you know, told by their parent that they don't want them to come into work because they don't have the right protective gear. And, you know, there's just these stories that are coming up about team members having their own family members not wanting them to come and do their jobs because they're worried about bringing infection into their whole family. You know, parents are saying to their 17-year-old children, you know, you can't work in dining because it's too much risk for us. And so these stories are generating this intense loyalty between the executive, from the executive team to the frontline team member. And like the quest for masks has been intense. And when we solved the problem, everybody celebrated. And it's been celebrated for like 2 weeks now. Everybody talks about the masks and getting the masks out. So anyway, so that's something that I think will stick. I'm going to be a part of trying to make it stick, but it's a whole change in the personalization of relationships. So that's it. That's what I wanted to share.
She's teaching a
Thank you.
QMAP class.
That's awesome. That's awesome. All right. And Rachel, you have been posting a lot of really cool stuff. And I didn't know, Rachel, if you wanted to have a chance to address the group. I don't even know if she's still on. Are you still there, Rachel?
She doesn't have a microphone.
Okay. Oh, okay. Darn it. Okay. And Terry, you've been posting a lot of good stuff. Terry and I have been talking since about 20 minutes before we started today. And I didn't know, Terry, if you wanted to have a chance to speak to the group. Okay. All right. So, oh my gosh, I'm seeing lots of good stuff in the chat box. Anybody else want to say anything about what you hope won't change?
Denise, Terry said in the chat box that she's not sure how to unmute herself.
Oh, okay. So you go down, Terry, you go down to that microphone again where you muted yourself, and you can unmute there, or if you're on your phone, unmute your phone. Oh, that's right. She dialed in from her phone. So you should be able to just unmute from your phone. Yeah, I'm not hearing. Okay. Meredith, are you seeing anybody else we might want to call on? I'm trying to keep up with the chat box.
Tina, you had your hand up earlier. Did you get to share and I missed it? Tina Taylor?
Oh, I think it was like a while. I think it was something I was thinking about a while back. I know I was just like really struck by what Jack was kind of sharing about just, you know, what our stories are and how powerful stories are. And I think that is so true. And I spoke with a family member who just was saying like she was so struck by everything that they're seeing on the news. And it is like the news is scary. It can be really scary and overwhelming to watch. And you could flip through the channels and see 10 different versions. And so I just think being able to share the power of people's stories right now is so important. And our elders just not our elders have such powerful stories, and they are they really are just so impactful, and especially right now, they're the things that they are sharing and seeing, and that they're willing to share with our community, I think are just really powerful. And the lessons that we're learning as care partners in this has been really powerful.
Thank you very much, Tina, for picking up on that. I'd like to flip it and give it another side. One is that when you interview the elders and write up their story so that you can use it with the media, you do something else. Recently, we had an experience with virtual reality, and they were trying to use virtual reality to teach staff to be empathetic with the elders. So people had to strap on something that isolated them totally from the real world, and then they experienced certain things that were supposedly what it's like to be old. And and their purpose was to teach empathy. I think there's nothing that can teach empathy more than asking staff members to interview residents and get their stories and tell their stories. That may be old-fashioned, maybe involves writing, but with social media, it can take off. But that is the way you build empathy. So we can get this bonding going both ways. Number one, we honor the people whose stories are told, but we're also helping those who are telling the stories to feel better about themselves and their work and to be better at doing that work.
Very nice. And I see Terry figured out how to unmute her phone. So Terry, you can have the floor.
Thank you. Yeah, that was weird. I'm not used to using this phone, and we got it good to go. So I was recently interviewed on Life with Dementia, which is a podcast made by Caregivers Alberta, which is focused mainly around, how can they help caregivers fully support those living with dementia in like a home environment. I kind of brought a different perspective to it because I work in a lodge facility. But I mean, a lot of the aspects are still the same. It's focusing on those one-on-one connections and really, even though we're in a very poor situation, taking advantage of it and changing our culture around it. Really connecting one-on-one with those people, getting to know their likes, their dislikes, what really gets them going. Because I feel right now, what we need more than anything is just something to, motivate us and push us through. What are we looking forward to? And those things are going to shine and pull us through right now. And just helping people that are maybe losing sight of those things has become like one of my main priorities, is saying, hey, we still have these things that we're all fighting for. We're fighting together. Let's keep going.
Very nice. I'm glad you got unmuted. Thank you.
Yeah, that was great. Thank you.
Very cool. All right, so we got 2 minutes left. So anybody want to say any closing, wrap it up kind of comments? Sister Imelda, you're muted. Look, there you are.
Yes, this was just a wonderful hour. And I think you spurred it on by giving us a question to think about, along with participating in current events, as we mentioned, Rachel. Is there a question or a thought or a concept that we want to bring to next week's meeting?
Imelda, did you have something in mind?
No, I didn't. Nothing came to mind. But I do love that. I do love this concept of getting stories and getting them out there, because it's great.
This is Carmen. Hi, everybody. I sort of have an idea along those lines, kind of combining things that are being said. And here's a story that's prompting it. I'm getting to do consulting over the phone with one of our new greenhouse models in Colorado. And a woman living with dementia really misses her husband. And they said, we thought the Zoom would confuse her. And so I just happened to say, well, why not try it though? People are used to looking at screens like television screens. She sees her husband. We're used to looking at photos. People are used to videos more than ever before, And so I have this email that they sent me. They said, Zoom chat was a win. I talked to them about just trying anyway. They set it up. The woman turned her head when she heard her husband's voice and smiled. I guess he was smiling ear to ear. A nurse tried to get in the screen and say hi, and the woman living with dementia said, "Get out." So what does that tell you? And to me, I like to frame it, everybody, as giving people the benefit of the doubt. You know, that's what we don't give people living with dementia. And I wonder if we could maybe turn that into the question moving forward. How can we get better at giving people the benefit of the doubt? It kind of fits with what was just said about Jack. I too have been having to switch my thinking from simulating things to just asking the people living with these conditions, right? And giving people, even with dementia, the benefit of the doubt and asking them. And maybe they can't answer every time, but maybe they can sometimes. So it's just a thought.
Thank you. I see some, yes, definitely we should plan on doing that. So I will put that in the email follow-up with the recording and all that kind of stuff for you guys to process. And if you have any other ideas of topics, would love to hear from you. This is the 17th. We have these calls scheduled through next week. So that other question is, do we want to keep going into May? Because if we do, then I'll make sure that link is set up and we're good to go for Fridays in May too. If this is meaningful to you and you want to keep it going, we can totally do that. So we'll ask that question next week as well. But if you have other ideas about questions, I'll stick around. You can put them in the chat box. And I think that's all we have to cover for today. And I want to thank you. Jill, go ahead.
If I could just let everybody know, so Monday, so we've been doing Facebook Live shows from the Eden Alternative Facebook page. They've been amazing, and people have been joining in and sharing comments and questions. And this Monday the 20th at 3:30 Eastern Time, we have Emmy Kyoto. If you don't know her, she's the founder of Ibasho, as well as Dr. Al Power and Ann Wyatt. And we are going to be talking about the role of elders in disaster recovery. And if you don't know Emmy's work, check out ibasho.org ahead of time. She is amazing. Can't wait for this conversation. And SWBR Architects is sponsoring that. So we're really, really thankful for that and excited about the conversation.
Very cool. Very cool. Anybody else, any closing comments? All right. Well, you will be getting the recording, the chat log, all that good stuff. And thank you all. Have another great week. Spring is coming, and we'll talk again next Friday.
Group hug.